How are you doing, guys? It's Dermot. I'm the clinical director here at Resync Physiotherapy, and I'm just going to talk to you a couple of minutes about the running injury assessment that we have going on in the clinic. Look, at a lot of runners, when they're in the middle of training, there's going to be niggles that are going to pop up, and sometimes you don't know where to go, how long to rest for, what kind of exercises you should be doing. But the most eager thing you're trying to do is actually get back running, especially around this time of the year when you're coming into the mid portion of your marathon training. Marathons are coming up at the start of October and the end of October, so you want to stay in the best shape. Now, what this injury assessment is aimed at is for runners who are kind of struggling with a little bit of injury. And that can be a calf, that can be Achilles tendon, that can be plantar fascia. Some people might be developing hamstring pain, knee pain, or hip pain. Anything that's kind of causing you a little bit of concern, we're able to do this in-depth assessment with in the clinic to get a little bit more laser focus about what you should be doing and how best we can get you back up to speed of what you were running at before those niggles caved in. We've done this assessment with a lot of different type of runners, like 800 meters. We have sub 3 marathon runners that are doing it. We have some of the ones that are longer into 5Ks, 10Ks, and we have some cross-country athletes coming in as well. So we understand the need for runners to be able to get back on the road, but also have the confidence to say that, right, I'm getting back on the road, this is going to feel fine if I follow this structure, and that's what we provide. We provide a little bit more clarity around what the injury is, what weaknesses or deficits have kind of lead you up to having that niggle, and what you're doing that it's not helping that niggle to resolve. So with the assessment, it gives us a lot of information where we can laser focus our attention to certain areas. So we're looking for the big wins. A lot of the athletes come into us, there'll be gaping holes in their strength profile based on the assessments that we do, or there'll be a gaping hole in the way that they're training, or they're not getting enough recovery in between sessions. And we provide a little bit more clarity around that, and it ultimately increases your confidence to kind of go, right, I know in the next 3 weeks that I'm going to be able to get back to my normal training session and have the confidence to do it. And like 9 times out of 10, it's going to come down to something that's very, very simple, but it mightn't be as obvious unless you did the assessment. What I mean by it might be quite obvious is that your training load might have spiked an awful lot, your body hasn't recovered, you're developing this niggle, it never really went away because you were continuing on your training program, and you thought it might just ease off. But 9 times out of 10, you're going to have some of these niggles that if you ignore them, they're going to turn into something bigger. So the idea behind it is to give that confidence and that clarity to you as a runner, and give you a plan to get back on the road as quickly as possible. So the test itself is actually relatively simple. Like, we'll put you through a movement screen, we'll put you through a biomechanical screen, we'll look at your running gait in a slow motion analysis. We'll also put you on a forced X, and basically what that does is it shows us how much strength you have when your foot lands on the ground and how quickly you're able to utilize that strength to spring back off again. So what we'd want to see is we want to see a nice hop progression as you're running rather than a bit of a plod, and it gives us an idea of what type of exercises we should be prescribing for you to increase that bounciness as you're running rather than that heaviness that you might be experiencing if you're injured. From there, once we get it, we're able to point out exactly where your deficits lie, and we're able to give you some exercises that will tend to close those strength gaps that you have there, and then a bit more advice of kind of going, right, when can I go back into running? We don't believe in taking people off running unless it's absolutely necessary and you've been running through pain for a couple of weeks, where those tissues need that little bit more time to settle down and be managed a little bit better before we start to reintroduce the running. Even if we do have to take people off, which is not very, very common, we still have a protocol in place to try and maintain your fitness, so that you're not losing any cardiovascular gains that you would have done throughout your training. We want to try and go into a maintenance phase while that injury recovers, and then come back out the outside of it with the tools that you need to get to the end of your training session. It's very, very difficult to get to the start line. The training is all done then, but keeping your body right to get through that training session, especially when you work, your family, your kids, you have everything that's kind of pulling and dragging your energy, and at the end of the day you have to really pull yourself out to kind of get that session done. Well, if we can provide a little bit more clarity and confidence in what your body needs to get you back on track and achieve that marathon or that 5k or 10k goal, then that's where the running assessment comes in. It is very laser focused. It does give us a lot more information, and it has worked in the past, and the protocols that we're using are pretty spot on. So guys, if you have any questions regards running assessment, please don't hesitate to contact us. We hope to see you in the clinic and get you back on the road as fast as we can. Okay, talk to you soon. Take care.